Hello! As a provider at Miramont Family Medicine, you will have ample opportunity to provide corticosteroid and replacement hyaluronic acid injections for your patients. Typically, these can be done in the shoulder, elbows, knees, trochanteric bursa, for tenosynovitis, carpal tunnel, etc. It is important to remember that being efficient is part of what makes Miramont great. And in order to be efficient, there's two things you need: a well-organized injection tray and a medical assistant. If you're doing the injections without a well-organized injection tray or without a medical assistant, you will take longer, you will not be as safe, you will not be as efficient, and you won't be able to do injections as regularly. Let's go through the process. First is you want to identify an appropriate candidate, typically a patient who you've already x-rayed and looked at the joint and have determined that they have failed conservative management or they're in great pain and need relief today. Second, you want to get your medical assistant in the room. We're going to be doing a flex injection at this time in room 2. I'll need a medical assistant at this time. The tray should be kept handy and should be kept stocked. So let's go over the knee injection first. It's important that you have the patient positioned properly. You want to have the knee flexed at 90 degrees, and you want the back of the popliteal fossa up tight against the examination table so that there's no wiggle room. I like to actually sometimes even place my knee a little bit against the foreleg so that if the patient jumps or jerks, I am able to stabilize things and keep a non-moving target. Second, I'm going to identify the patellar tendon. And there is a thickened area just right under the kneecap or patella. And then there's an indented area on either side. I kind of like to think of my hand as like a little claw or pincher. I'm just going to feel that little indentation. And that little soft spot is going to be my target. It corresponds along the medial joint line, and I'm going to be aiming back 45 degrees angle from off center toward the center of the joint. Remember that the joint is a hollow ball, so we can enter the joint in any direction and the medicine is going to fill inside. A well-trained medical assistant will probably know what you need before you even ask for it, but in general you're going to be asking for your betadine swab, and I like to use a Kleenex to do the entire procedure rather than gauze. I'll take a betadine swab, please. Now the swab typically has enough iodine to use just a single. I'm going to make a little mark in that little spot that I was just identifying, and I'm going to then clean, starting at the center, and move out, and flip the swab over and do it a second time. And that little dimple I made is going to be my target. And the nice thing about this over using a pen is it doesn't get cleaned off when I use the swab. And the indentation will actually stay there for about 4 to 5 minutes, so I have plenty of time to work. I'm next going to just dab a little lightly with Kleenex because it keeps it less messy and prevents us from inadvertently soiling her clothing. Next, I'm going to ask for a 3 cc syringe. Don't use a 5. Even though it has a higher capacitance, the pressure that you need to press the medicine is going to cause more pain. And a 1 cc syringe is not efficient because you won't be able to put in as much medicine. I like to use a 30 gauge 1 inch. It causes less pain. Go bevel up. Bend your needle in just a little bit. You'll have more control. It makes it more like a pencil where I'm now just using my fingers to manipulate as opposed to having to use my whole elbow. I like to press or indent inside that spot where I just did the betadine swab. It helps provide some analgesia. And then I pinch and tent up. I'm going to barely go in just a little bit right into my target and start injecting some medicine. A tiny wheel, almost like doing a PPD. I'm now going to rotate up, which again that bend in my needle allows me to do. I'm pointing straight back at my target, and I'm always pressing and advancing medicine ahead of the needle so that she's not feeling that fine point. And then I'm going to put about half of that actually into the joint. First half I just went into the tract to numb it out. If you do get a little spot of blood there, not a big deal. Tear a tiny patch off of your Kleenex instead of set it there just like when someone shaves and cuts themselves. And then we'll use a 27 gauge needle, which is a little thicker because we're pushing you flex it today, and it's very viscous. I've already numbed my tract, so she should be well anesthetized, and I don't need to bend the needle this time. We can just go straight in that same direction. I do push a little medicine ahead, and now I'm going to fill the joint with 1 cc of Marcaine. I'm now going to remove the needle and ask for the Euflexa. The Euflexa is very expensive, so you want to make certain that you handle it properly. Don't drop it. Make sure the bevel is on tight. And I'm going to use one hand here to stabilize with my thumb underneath the needle. And I've got my hand resting on the needle at all times. And I'm just going to press with constant firm pressure. And notice this is going to take about 10 to 15 seconds for me to actually push it in. But I'm confident I'm in the joint. I mean, you can withdraw if you want to look for blood, but confident I'm in the joint. And I'll take a Kleenex. And I'm just going to dab and pull the needle out, and the needle's going to go into the sharps container. Now it's really important that I hold pressure here until the bandage is in place, because if I did skewer a blood vessel or something, we want to have immediate pressure on that area to prevent a hemarthrosis. So I'm going to apply pressure. Maylee's ready with the Band-Aid, so she's now going to apply that. And she pulls it taut. And now we're going to cover with 4-inch Coban. And this is going to act as a pressure dressing. Because it can become a tourniquet, we don't want the patient to leave this on for more than an hour. And so we'll make note of the time. It's 1 o'clock. Be sure to take this off about 2 o'clock, please. Mm-hmm. With practice, you can get to the point where doing a Euflexa injection or a corticosteroid injection will routinely take you and your MA team less than 2 minutes. Finally, don't forget about the coding. Your medical assistant or scribe can typically do this for you, but if you need to do it yourself, just make certain that you've not only billed for the arthrocentesis, which is the 20610, but you've also included the J code for the hyaluronic Euflexa, or if you use triamcinolone, whatever the appropriate J code is. If you are using triamcinolone, you'll use a multiplier times 4, for example, to indicate 40 milligrams. But because the Euflexa is billed in units of 1 vial, we'll just use the multiplier of 1. If you're doing both knees, you have to do bilateral. And if the only thing you're doing that day is the procedure, you would not bill a 99214 or need an M code. You're just going to bill the procedure code unless you have other HPI items to bill it under.